Hi, and welcome viewers of Nursing Academy 101. In this video, we will talk about latest psychosocial integrity related multiple choice questions for nurses along with the answers and rationales part 1. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question number 1. A nurse is caring for a client with depression who has been prescribed selective serotonin reuptake inhibitors (SSRIs). Which statement by the client indicates an understanding of the medication therapeutic effects? A. The medication will help me sleep better at night. B. I will feel an immediate improvement in my mood. C. The medication will increase my energy levels. D. It may take a few weeks for the medication to start working. The answer is D. It may take a few weeks for the medication to start working. SSRIs are commonly prescribed for depression, but they do not provide immediate relief. It takes several weeks for these medications to reach therapeutic levels and start producing noticeable improvement in the client's mood. It's important for the client to understand this delay to avoid discouragement or premature discontinuation of the medication. Question number 2. A nurse is assessing a client with bipolar disorder who is experiencing a manic episode. Which finding would the nurse expect to observe? A. Slowed speech and psychomotor retardation. B. Depressed mood and decreased energy levels. C. Flights of ideas and increased goal-directed activity. D. Excessive sleepiness and decreased appetite. The answer is C. Flight of ideas and increased goal-directed activity. During a manic episode, clients with bipolar disorder often experience an elevated mood characterized by an expansive or irritable mood, increased energy levels, and excessive involvement in goal-directed activity. They may also exhibit rapid speech, a flight of ideas, racing thoughts, and decreased need for sleep. Question number 3. A nurse is providing care to a client with delirium. Which nursing intervention is the highest priority for the client? A. Administering prescribed antipsychotic medication. B. Providing a quiet and well-lit environment. C. Ensuring the client's physical safety. D. Assisting with reality orientation techniques. The answer is C. Ensuring the client's physical safety. Delirium is characterized by acute confusion and a fluctuating mental state. The highest priority in caring for a client with delirium is ensuring their physical safety. Clients with delirium may be disoriented, agitated, or have impaired judgment, making them prone to accidents, falls, or self-harm. Therefore, ensuring their safety takes precedence over all other interventions. Question number 4. A nurse is caring for a client with schizophrenia who experiences auditory hallucinations. Which nursing intervention would be most appropriate for managing the hallucinations? A. Encouraging the client to confront and challenge the hallucinations. B. Distracting the client with engaging activity. C. Assisting the client in reality testing. D. Administering an anti-anxiety medication. The answer is C. Assisting the client in reality testing. When a client with schizophrenia experiences auditory hallucination, the nurse should assist the client in reality testing. This involves helping the client differentiate between what is real and what is not by providing objective information and encouraging the client to share their perceptions. The nurse can help the client gain insight into the hallucinations and develop coping strategies. Question number 5. A nurse is caring for a client who is experiencing alcohol withdrawal. Which medication would the nurse anticipate administering to manage the client's withdrawal symptoms? A. Diazepam Valium. B. Haloperidol Haldol. C. Naloxone Narcan. D. Disulfiram Antabuse. The answer is A. Diazepam Valium. Alcohol withdrawal can cause severe symptoms, including agitation, tremors, seizures, and hallucinations. Benzodiazepines, such as diazepam Valium, are commonly used to manage alcohol withdrawal by reducing anxiety, preventing seizures, and promote sedation. Diazepam helps alleviate withdrawal symptoms by enhancing the inhibitory effects of the neurotransmitter GABA in the brain. Question number 6. A nurse is conducting a therapeutic group session for clients with substance use disorder. One client consistently dominates the conversation and prevents others from sharing their experiences. Which intervention should the nurse implement? A. Encourage other clients to speak up assertively. B. Ask the dominating client to allow others to share their stories. C. Redirect the conversations to a different topic. D. Assign a group leader to moderate the session. The answer is B. Ask the dominating client to allow others to share their stories. In a therapeutic group session, it's important to ensure equal participation and involvement of all members. The nurse should address the dominating client and respectfully ask them to allow others to share their stories. This intervention promotes active participation and engagement from all group members, fostering a therapeutic and inclusive environment. Question number 7. A nurse is caring for a client with post-traumatic stress disorder (PTSD) who experiences frequent nightmares. Which intervention should the nurse implement to assist the client in managing nightmares? A. Encourage the client to avoid sleep. B. Teach the client relaxation techniques. C. Administer a sedative medication. D. Restrict fluid intake before bedtime. The answer is B. Teach the client relaxation techniques. Nightmares are common in clients with PTSD. Teaching relaxation techniques such as deep breathing exercise or progressive muscle relaxation can help the client manage anxiety and promote restful sleep. Relaxation techniques provide the client with coping mechanism to reduce the frequency and intensity of nightmares without the need of medication. Question number 8. A nurse is caring for an older adult client who has recently lost their spouse. The client expresses feeling of loneliness and isolation. Which nursing intervention is most appropriate to address the client's psychosocial needs? A. Encouraging the client to join a support group for bereaved individuals. B. Suggesting the client get a pet for companionship. C. Assisting the client in finding a new romantic partner. D. Arranging regular visits with family members and friends. The answer is A. Encouraging the client to join a supportive group for bereaved individuals. The loss of a spouse can lead to feelings of loneliness and isolation, especially in older adults. Joining a support group for bereaved individuals can provide the client with a safe space to share their experience, receiving emotional support, and connect with others who have gone through similar situations. Support groups offer a sense of community and understanding which can help alleviate feelings of loneliness. Question number 9. A nurse is caring for a client with borderline personality disorder (BPD) who engaged in self-harming behaviors. Which nursing intervention is the priority for managing this client's safety? A. Encouraging the client to express their feelings verbally. B. Assessing the client's self-harm risk factors and triggers. C. Administering antipsychotic medication to reduce impulsivity. D. Setting strict limits and boundaries with the client. The answer is B. Assessing the client's self-harm risk factors and triggers. When caring for a client with BPD who engages in self-harming behavior, the priority is to assess the client's self-harm risk factors and triggers. Understanding the factors that contribute to self-harm allows the nurse to develop a comprehensive safety plan and implement appropriate intervention. By identifying triggers, the nurse can work collaboratively with the client to develop alternative coping strategies and reduce the risk of self-harm. Question number 10. A nurse is caring for a client who is experiencing an acute panic attack. Which nursing intervention is a priority during the panic attack? A. Providing a quiet and calm environment. B. Administering a prescribed anxiolytic medication. C. Instructing the client to take slow, deep breathing. D. Assisting the client in identifying irrational thoughts. The answer is A. Providing a quiet and calm environment. During an acute panic attack, the priority is to create a quiet and calm environment for the client, reducing environmental stimuli, such as noise and distractions, helps minimize the client's anxiety and allow them to focus on self-soothing techniques. Once the client feels more secure and their anxiety starts to subside, other interventions such as administering medications or teaching coping strategies can be implemented. Question number 11. A nurse is caring for a client with major depressive disorder who is prescribed tricyclic antidepressants (TCAs). Which statement made by the client indicates an understanding of the nurse teaching about TCAs? A. I should take the medication only when I feel really depressed. B. I can expect to experience the full effects of the medications within a few days. C. I need to be careful about rising slow from lying or sitting position. D. I can safely consume alcohol while taking this medication. The answer is C. I need to be careful about raising slowly from lying or sitting position. Tricyclic antidepressant TCAs can cause orthostatic hypotension as a side effect. Therefore, clients taking TCAs should be cautious about raising slowly from lying or sitting positions to prevent dizziness or fainting. This statement indicates that the client understands the potential adverse effects and necessary precautions associated with TCAs. Question number 12. A nurse is caring for a client with a history of substance use disorder who is being treated for an unrelated medication condition. Which intervention is most appropriate for managing the client's care while addressing their substance use disorder? A. Refusing to provide pain medication to the client. B. Encouraging the client to discontinue their prescribed medication. C. Collaborating with the client's addiction specialist for a comprehensive treatment plan. D. Withholding information about the client's substance use disorder from the healthcare team. The answer is C. Collaborating with the client's addiction specialist for a comprehensive treatment plan. When caring for a client with a history of substance use disorder, it's essential to collaborate with their addiction specialist to develop a comprehensive treatment plan. This ensures that the client's medical needs are addressed while considering their substance use history. By involving the addiction specialist, the nurse can ensure a coordinated approach to care that supports the client's recovery and manage their medical condition effectively. Question number 13. A nurse is caring for a client with schizophrenia who is experiencing command hallucinations instructing self-harm. Which intervention should the nurse prioritize? A. Documenting the content and frequency of the command's hallucination. B. Encouraging the client to engage in distracting activities. C. Administering an antipsychotic medications as prescribed. D. Isolating the client in a quiet room for safety. The answer is C. Administering an antipsychotic medication as prescribed. Command hallucinations instructing self-harm are a significant concern in clients with schizophrenia. The priority intervention is to administer an antipsychotic medication as prescribed. Antipsychotic medications help reduce the severity and frequency of hallucinations and delusions, which can alleviate the distress and potential harm associated with common hallucinations. Question number 14. A nurse is caring for a client with anorexia nervosa. Which intervention should the nurse implement to address the client's body image disturbance? A. Encouraging the client to weight themselves daily. B. Providing positive reinforcement for weight loss achievement. C. Promoting self-acceptance and focusing on non-appearance related qualities. D. Assisting the client in creating a restrictive meal plan. The answer is C. Promoting self-acceptance and focusing on non-appearance related qualities. Body image disturbance is a significant concern in clients with anorexia nervosa. The nurse should implement interventions that promote self-acceptance and focus on non-appearance related qualities. By encouraging the client to value their intrinsic worth and other aspects of themselves beyond their appearance, the nurse helps shift the client's self-perception away from solely body-related concerns. Question number 15. A nurse is conducting a group therapy session for clients with anger management issues. One client becomes verbally aggressive toward another group member. Which intervention should the nurse implement first? A. Confront the client and express disapproval of their behavior. B. Remove the verbally aggressive client from the group session. C. Allow the group members to address the situation and provide feedback. D. Model calm and assertive communication techniques for the group. The answer is D. Model calm and assertive communication techniques for the group. When a client becomes verbally aggressive towards another group member, the nurse should model calm and assertive communication techniques for the group. By modeling appropriate behavior, the nurse provides a positive example of how to manage anger and conflict in a therapeutic manner. This intervention helps set the tone for respectful communication and encourages other group members to follow suit. Question number 16. A nurse is caring for a client with dementia who frequently becomes agitated and aggressive. Which intervention should the nurse prioritize to manage the client's behavior? A. Administering sedative medication as prescribed. B. Using redirection and distraction techniques. C. Applying physical restraints to ensure safety. D. Limiting the client's social interactions. The answer is B. Using redirection and distraction techniques. When caring for a client with dementia who displays agitation and aggression, the priority intervention is to use redirection and distraction techniques. These techniques can help redirect the client's attentions from the triggering stimuli and engaging them in a more positive and calming activity. It's important to use non-pharmacological interventions first before considering medication or restrictive management. Question number 17. A nurse is caring for a client with antisocial personality disorder who exhibits manipulative behaviors. Which nursing response is most appropriate when the client attempts to manipulate the nurse? A. Set clear and consistent boundaries with the client. B. Ignore the client's manipulative behaviors. C. Allow the client to manipulate in order to maintain rapport. D. Confront the client about their manipulative behaviors. The answer is A. Set clear and consistent boundaries with the client. When caring for a client with antisocial personality disorder who exhibits manipulative behaviors, it's crucial to set clear and consistent boundaries. Establishing boundaries helps maintain a therapeutic relationship while preventing the client from exploiting or manipulating the nurse. By setting boundaries, the nurse maintains a professional and assertive stance, which promotes appropriate behavior and mutual respect. Question number 18. A nurse is caring for a client with a history of domestic violence. The client discloses feeling unsafe and expresses fear of the abuser. What is the nurse's priority intervention? A. Encouraging the client to develop a safety plan. B. Providing resources for legal protection against the abuser. C. Reporting the abuse to the appropriate authorities. D. Assisting the client in leaving the abusive relationship immediately. The answer is A. Encouraging the client to develop a safety plan. When caring for a client with a history of domestic violence who expresses fear and concern for their safety, the nurse priority intervention is to encourage the client to develop a safety plan. A safety plan helps the client identify strategies to protect themselves, access support systems, and ensure their well-being. Living an abusive relationship can be complex and potentially dangerous, so empowering the client with a safety plan allows them to take steps toward their own safety at their own pace. Question number 19. A nurse is caring for a client with bipolar disorder who is experiencing a manic episode. The client insists on going shopping and spending a large amount of money. Which nursing intervention is most appropriate? A. Accompany the client to ensure they don't engage in impulsive spending. B. Encouraging the client to spend money wisely and within a budget. C. Set limits and establish a structured schedule for the client's activities. D. Avoid intervening and allowing the client to manage their own finances. The answer is C. Set limits and establish a structured schedule for the client's activities. When caring for a client with bipolar disorder experiencing a manic episode, setting limits and establishing a structured schedule is the most appropriate intervention. Manic episodes often involve impulsivity and poor judgment, including excessive spending. By setting limits and establishing structure, the nurse helps manage the client's impulsivity and reduce the risk of financial harm or consequences associated with manic behavior. Question number 20. A nurse is caring for a client with generalized anxiety disorder (GAD) who is experiencing chronic worrying. Which nursing intervention is most effective in helping the client manage their anxiety? A. Encouraging the client to engage in physical exercise regularly. B. Teaching the client deep breathing and relaxation techniques. C. Administering anxiolytic medication to reduce anxiety symptoms. D. Suggesting the client avoid situations that trigger anxiety. The answer is B. Teaching the client deep breathing and relaxation techniques. When caring for a client with generalized anxiety disorder (GAD), teaching deep breathing and relaxation technique is an effective nursing intervention for managing anxiety. Deep breathing exercise and relaxation techniques, such as progressive muscle relaxation, can help the client reduce their anxiety levels and promote a sense of calm. These techniques provide the client with coping strategies that can be utilized in various situations, empowering them to manage their anxiety more effectively. Question number 21. A nurse is caring for a client diagnosed with delirium. Which intervention should the nurse prioritize to promote the client's safety? A. Providing a calm and structured environment. B. Administering antipsychotic medication as prescribed. C. Encouraging the client to engage in physical exercise. D. Limiting visitors to reduce stimulation. The answer is A. Providing a calm and structured environment. When caring for a client with delirium, the nurse's priority is to provide a calm and structured environment. Delirium is characterized by confusion, disorientation, and alternations in attention and awareness. Creating a calm environment helps reduce sensory overload and provides a sense of security, which promotes safety and facilitates the client's recovery. Question number 22. A nurse is caring for a client with a substance use disorder who is attending group therapy. The client frequently interrupts others and disregards group rules. Which intervention should the nurse implement first? A. Confront the client about their disruptive behavior. B. Assign a different group therapy time for the client. C. Implement consequences for the client's disruptive actions. D. Set clear expectations and boundaries for the group. The answer is D. Set clear expectations and boundaries for the group. When a client with a substance use disorder consistently interrupts others and disregards group rules, the nurse should first set clear expectations and boundaries for the group. Establishing clear guidelines help create a structured and respectful therapeutic environment. By communicating expectations to the entire group, including the disruptive client, the nurse promotes an atmosphere conducive to effective group therapy. Question number 23. A nurse is caring for a client diagnosed with post-traumatic stress disorder (PTSD). Which intervention is most appropriate for addressing the client's symptoms? A. Encouraging the client to avoid triggers associated with the traumatic event. B. Teaching the client relaxation techniques to manage anxiety. C. Administering selective serotonin reuptake inhibitor (SSRIs) as prescribed. D. Encouraging the client to suppress memories related to the traumatic event. The answer is B. Teaching the client relaxation techniques to manage anxiety. For a client with post-traumatic stress disorder (PTSD), teaching relaxation techniques to manage anxiety is an appropriate intervention. PTSD is characterized by intrusive memories, hyperarousal, and anxiety. Relaxation techniques such as deep breathing, progressive muscle relaxation, or guided imagery can help the client reduce anxiety levels and promote a sense of calm. These techniques empower the client to cope with and manage their symptoms effectively. Question number 24. A nurse is caring for a client diagnosed with schizophrenia who experiences auditory hallucination. Which nursing intervention is most appropriate for addressing the client's hallucinations? A. Acknowledge the client experience and provide a supportive presence. B. Confront the client about the irrationality of their hallucinations. C. Encourage the client to ignore the hallucination and focus on reality. D. Administer anxiolytic medication to reduce anxiety related to hallucinations. The answer is A. Acknowledge the client's experience and provide a supportive presence. When caring for a client with schizophrenia experiencing auditory hallucinations, the most appropriate nursing intervention is to acknowledge the client's experience and provide a supportive presence. It's important to validate the client's feeling and reality while maintaining a non-judgmental approach. Providing a supportive presence builds trust, fosters therapeutic rapports, and helps the client feel understood and heard. Question number 25. A nurse is caring for a client with a history of self-harm who is exhibiting signs of escalating agitation. Which intervention is the nurse's priority in maintaining the client's safety? A. Restraining the client to prevent self-harm. B. Administering an anxiolytic medication as prescribed. C. Removing potentially harmful objects from the environment. D. Implementing de-escalation techniques to calm the client. The answer is D. Implementing de-escalation techniques to calm the client. When caring for a client with a history of self-harm who is exhibiting escalating agitation, the next priority intervention is to implement de-escalation techniques to calm the client. De-escalation techniques involve using therapeutic communication, active listening, and non-confrontational approaches to diffuse heightened emotional and promote a sense of safety. Restraints should only be used as a last resort when all other interventions have been unsuccessful and there is an immediate risk or harm to self or others.